Thank you very much for that welcome, and it's a real privilege to be the Secretary of State for Health and Social Care. And I love the NHS, and I wanted to talk today about what we're going to do to make sure that it's always there for you and your family, in the way that it's always been there for mine. Last year, my sister Emily had a near-fatal brain injury. Her life was saved by the NHS at Southmead Hospital in Bristol. And last month, I had the chance to go back with her to Southmead and to say thank you. They took us into the helipad where she'd been taken off the ambulance, and then they took us in through A&E where they'd stabilised her, and then into the intensive care unit. And as we walked in, standing there, directly opposite her, was the consultant who'd looked after her. And until that moment, she couldn't remember anything about it. But when she saw him, she knew exactly who he was, and she went over and gave him a great big hug. It was an incredible moment. And when she thanked him, his reply will always stick with me. He said, "It wasn't just me, it was the whole team." And that sums up our NHS. Now, I love my sister, and the NHS saved her life. So when I say I love the NHS, I really mean it. But the truth is, they would have done this for anyone, for my sister, for yours. And what an honor it is to be in a position to be able to say thank you to the guy who saved your sister's life. So my heartfelt thanks is not just from one brother to one doctor or from one family to one hospital. No, the NHS is there for us all. And I want to say this, from everyone in this nation to every person who works in the NHS, we salute you, we value you, and from the bottom of our hearts, thank you. I'm very proud of the NHS for what it's delivering today. Cancer survival rates are at a record high, strokes are down by a third, deaths from heart failure down by a quarter, and the NHS is doing more than ever before. 39,000 more clinicians looking after patients than in 2010, 12,000 more nurses on our wards, 14,000 more doctors, 1 million more seen by cancer specialists every year, 2 million more operations, 3 million more treated in A&E. And the result of all this, at every age and every stage of life, people are healthier than ever before. That's what our NHS is delivering under this Conservative government. But anyone who knows the NHS also knows there are serious pressures because our population's aging and we're treating more people than ever before. I know this. It's clear to anyone. Social care is under pressure too. I know the pressures, and we're going to address them because I want us to make the NHS the best health service in the world. And today I want to talk a little about how. First of all, it can't be done without more money. The Prime Minister has committed an extra £20 billion over the next 5 years. £20 billion. It's the largest, longest financial settlement in the entire history of the NHS, and it'll underpin the NHS for the long term. And when people ask that we spell out our domestic agenda, you go and tell them this. We've taken this decision. We've made our choice. We've responded to the public mood and the clear needs of the service with boldness. And let me say this policy is not without cost. I know that, and I know that it's audacious, but I profoundly believe it to be right, and I'm proud to serve a Prime Minister who believes it to be right too. And this money comes on stream next year. But I want to help the NHS through this winter too. I've already provided extra funding for hospitals to make upgrades to their buildings to help deal with the pressures this winter. And I can announce today that I'm making an extra £240 million available to pay for social care packages this winter to support our NHS. We'll use the money to get people who don't need to be in hospital, but do need care, back home, back in their communities, so we can free up those vital hospital beds and help people who really need it get the hospital care they deserve. But I know that money alone isn't enough. We need to make sure that money is well spent by reforming the NHS and the social care system too, to make sure that it's always there for you and your family. So along with the NHS themselves, we're writing a long-term plan to guarantee its future. And I'm hugely grateful to my departmental team who are working together with me on these reforms. Steve Barclay, Caroline Dinage, Jackie Doyle-Price, Steve Brine, James O'Shaughnessy, Wendy Morton, Alex Chalk, and Maggie Throop. It's great working part of this team all pulling together. Thank you. And I tell you this about pulling together. We as a party, we've got to pull together too. Because we saw with Labour last week the frightening prospect for our country if we don't. They've got nothing new, and every time that programme's been tried, it's failed and brought misery on millions, and it is our duty to make sure it doesn't happen again. One of the major reforms we need to see is bringing new technology across the health and care system. And obviously, I've been able to consult widely about that in the last few days because CCHQ's given everyone my phone number. Now, of course, introducing new technology can be bumpy, as we all know. But the potential benefits are huge. And I say this to people who tell me that technology isn't always perfect. Of course it's not always perfect, but that's not a reason to reject new technology. That's a reason to improve new technology and keep making sure we get the best use of it. But the NHS is still the biggest buyer of fax machines in the country, maybe even the world. And this is putting a greater pressure on our NHS staff. And in some hospitals, a nurse still goes round with a clipboard to find out where beds are in use and where they're empty. It doesn't have to be this way. In Derriford Hospital in Plymouth, where I was on a night shift last week with Johnny Mercer, they've developed an in-house programme. So everyone knows where the empty beds are all the time. Patients get better treatment, and it's so much easier for staff. So we're going to sort out the technology in the NHS because our NHS deserves better. Now, of course, it's not just about sorting out the IT. It's also about seizing the huge opportunities. Let's take just one example. Today, it takes an average of over 5 years to diagnose rare diseases. 5 years, with endless tests and trial treatments. But thanks to the 100,000 Genomes project, now by combining your own gene sequence with machine learning on others, you can be diagnosed in days. And what's more, from just a swab of saliva, there's the potential to design a drug specifically to treat your unique biological code. In this city, the University Hospital is growing replicas of people's cancers in a lab to test individual drugs to see if they destroy the cancer before subjecting the patient to that drug. Now, this increases the chances of cure, and it reduces the agony of unsuccessful treatments. It is unbelievable technology, and it's happening right here in Birmingham. And I'm so proud that it's thanks to a decision by David Cameron and this Conservative government that this is happening at all. So I want to go further. And today I can announce that we're expanding our 100,000 Genomes project. So 1 million whole genomes will now be sequenced, along with a long-term vision of 5 million. And I want to make it available to all. And what this means in practice for you and your family is this. From today, our brand new NHS Genomic Medicine Service will roll out access to genomic testing. So for everyone with a rare cancer and for all seriously ill children, it'll be available on the NHS. So we'll have tailor-made treatments and tailor-made drugs that are the best fit for a patient and not a best guess. We're leading the world, and I'm incredibly excited about this technology just because of its sheer potential to change lives for the better. It's just one example, but it shows the kind of reform we need to make sure the NHS is the best health service in the world. But we all know that new technology is not enough to make the health and social care system sustainable. We need other reforms too. We've got to reform the system so we spend more time on prevention, not cure, with more integration between health and social care and more treatment closer to home. And what I mean by this is that the era of moving all activity into fewer and fewer larger hospitals and blindly, invariably closing community hospitals, that era is over. I want more services. I want more services closer to the communities they serve. And I want us to empower people to have more control over their own health too, whether it's the rising risk of obesity or the scourge of gambling addiction or the growing challenge of mental illness. These problems and the increasing demands they put on our health system, they can only truly be solved by prevention as much as cure. We can't go on treating them like medical problems. We need to look after people as people, not just patients, and foster a culture that's less popping pills and Prozac and more prevention and perspiration. And that includes acting on new evidence and interventions to support people with obesity and other conditions, whether it be through prescribing exercise, the arts, or nutritional advice, rather than yet more drugs and medical interventions. Or in the language I prefer to use, it's common sense. Now, these reforms of social care are needed too, to make that sustainable for the long term. So people don't have to fear the risk of losing everything if for a reason outside their control they end up needing care when they're old. Reform of social care is long overdue, and we'll publish a paper later this year setting out the progress that we can make to give all people confidence and dignity in old age. And of course, we can't do any of these reforms without our GPs. Our GPs are the bedrock of the NHS. They're everyone's first port of call. And because our GPs are the bedrock of the NHS, we need more of them, better supported, better equipped. Prevention of ill health is nothing without primary care, so we back our nation's GPs every step of the way. Now, I believe that this need for reform doesn't simply lie with the NHS or our social care system. We too, as a party, must be driven by the imperative of reform. We've always been at our best when we've been reforming, when we look to the future. Who abolished slavery in the 19th century? Who delivered equal votes for women in the 20th? Who delivered equal marriage in the 21st? Not the Whigs or the Liberals or the Labour Party, it was the Conservative Party. And throughout history we've shown that we're at our best, where we're in favour of the future, not fixated on the past. But it's more than that. We can't just be comfortable with modern Britain. We've got to be the champions of modern Britain. Pro-jobs, pro-business, pro-prosperity, helping out everyone who wants to achieve their potential. We can't fear the future. We've got to embrace the future. We embrace the future or we embrace defeat. The Conservative Party is the party that's always understood the spirit of this great nation. And that spirit today calls for opportunity for all, without fear or favour. Now more than ever, we've got to give it all we've got, because our opponents are not resting either. So let us unite together. Let us embrace our NHS. Let us embrace reform. And let us give it everything we've got and serve this great nation that we love. Thank you.